It's a pleasure, Elaine.
So we saw President Biden's action reverses what Trump did to Obamacare, opens re-enrollment, making health care available again to those who need it. Does this give immediate relief? I want to get your thoughts on these executive orders.
The president has put in place multiple sets of executive orders. The ones today were specific to the Affordable Care Act, and it's addressed to the 15 million Americans who have no health care insurance. And imagine what that's like in a time of a COVID pandemic. And this will open up the opportunity for them to enroll through what's called the exchanges, which will give them premium support from the government dependent upon their income, as well as giving them dollars to help pay the so-called deductibles or out-of-pocket expenses that they might encounter, with the hope that these individuals will be able to obtain insurance and be able to get the medical care they require.
Well, a lot of people outside the U.S. Looking into our healthcare system sometimes shake their heads. So if you can quickly explain for our international audience, what happens to those people who are uninsured, who are in the hospital fighting the coronavirus?
For your audience around the globe, the idea that not every citizen has coverage probably seems very foreign, because in most countries, that is part of the rights of citizenship. In the United States, it's not. It's a hodgepodge of coverage. People who are over age 65 have insurance through the government called Medicare. People who are poor have insurance through the government called Medicaid. About 155 million of the 330 million Americans have insurance through their employer, but there is a part of the population that truly has no coverage, and when they become sick and go to the hospital, they must pay it themselves, and very few of these individuals can afford to do so, and it's why bankruptcy from health care services and bills is the leading cause of financial harm in the United States today.
So, Dr. Pearl, how would you say the coronavirus has changed healthcare coverage and plans in the United States? What will we see coming down the line?
Well, so far, what it's done is to highlight the failures of the American healthcare system. It's why I wrote the book, Uncaring. Things like chronic disease. 88% of the people who have died in the United States have had 2 or more chronic diseases, and the United States does a poor job despite having a very expensive, high-priced healthcare system. Coming out of the coronavirus, my prediction as both a Stanford medical school and business school professor is that there will be tremendous economic pressure on every nation, but especially the United States. At the federal level, we will have borrowed trillions of dollars. At the state level, the tax revenues will decline. Unemployment is likely to be twice as high as it was prior to the pandemic, and a huge number of small businesses will be out of existence with their employees looking for jobs. And I think there's going to be a lot of pressure to move towards a more organized system of healthcare, one in which the total cost is paid and in which the organization of the delivery system, the doctors working together, the hospitals working together, the information technology could be better than in the past. The physician culture has been very resistant to these types of changes, but I'm hopeful that actually following the pandemic, it will be a catalyst for change.